Hi, it's Celina Nadelman, and I wanted to talk about something that me and my girlfriends were discussing the other day. A lot of information is coming out about these weight loss drugs in the media, especially called glucagon-like peptide 1 receptor agonists, namely Ozempic and Mounjaro, and whether there is a link to thyroid cancer. So I looked at the literature, and I just want to let you know a little bit about these drugs. Glucagon-like peptide 1 receptor agonists are used to widely treat type 2 diabetes. The drugs mimic the action of GLP-1, an endogenous hormone that's produced by the intestine in response to food. And these hormones bind to receptors on the pancreas, the beta cells, and then stimulate insulin production. So what does insulin do? It takes glucose out of the bloodstream and it puts it into the cells. You don't have sugar floating in the bloodstream. Now, there are receptors not only in the intestine, but also they find receptors in specific cells of the thyroid. They're called C cells, and C cells produce calcitonin. And calcitonin is a hormone that is important for bone health. And so there could be an increase in C cells, or, because it's being turned on by this GLP-1 agonist, meaning like it's a turn on hormone, and presumably increase the risk for a type of thyroid cancer called medullary thyroid cancer. Now, medullary thyroid cancer is not the most common form of thyroid cancer. There are many different types of thyroid cancer. The most common is called papillary thyroid cancer. But we just don't know that much about these drugs. And I had the other day a patient who came in who uses Mounjaro because she has PCOS, or polycystic ovarian syndrome, and it controls her diabetes. And she just wanted to make sure that her thyroid was good. And she had an ultrasound of the thyroid and found a very small thyroid nodule. Now, normally a sub-centimeter thyroid nodule does not get biopsied because there are certain indications that need to be met. But in her case, we did the thyroid biopsy, and lo and behold, she had a thyroid cancer. So it kind of made me think about this, although it wasn't a medullary thyroid cancer, but I thought, these new medications, we don't know enough about their interactions with our hormones. So maybe we should be cautious and at least do some kind of screening or, thyroid ultrasounds if you decide to go on Mounjaro or Ozempic. Just a thought.